Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. I've been drilling down on carbohydrates in the last two videos, okay? I've been explaining, I don't want you to think in terms of healthy versus non-healthy carbohydrate for the most part. I just want you to learn to identify them, what they are. They raise your blood sugar, they'll raise your insulin level, they'll keep you from losing weight, okay? We're talking about losing weight. That's what we do here at Dr. Simonds Weight Loss, okay? So getting these things out of your diet is important. So I talked about all forms of refined grain, all forms of sugar. I've talked about all forms of starch, okay? And I've just named off examples and common things people tell me that they don't think are carbohydrates that are. So if you've watched the last two videos, you're getting the idea. Now, there is maybe one exception here, okay? So fiber is technically a carbohydrate. So when you eat a piece of celery or a piece of broccoli, that has a lot of fiber. And you'll see that listed if you look up different food sources. You'll see that broccoli and celery, for example, have some carbohydrate. But you and I know that that's not from added sugar because they don't taste sweet. None of that stuff tastes sweet, okay? Think of the fiber in there as being like cardboard. You don't digest that. You cannot digest that quickly. It cannot be absorbed quickly, and there's absolutely no way that that could ever raise your insulin level. So I'll cut you some slack. If you're somebody who really looks at nutritional data, you'll notice some vegetables have carbohydrates. But the form of carbohydrate in there is fiber that does not change your blood sugar. And so this is the one exception to the carbohydrate rule that I routinely just say, okay, this is okay. So I want to encourage you that if you were to look at the vegetables and you see that there's a bunch of, there's carbohydrate in there, I want to, just assure you that that is from fiber and it's okay to have those. And that's why I promote those so much. So this is the one form of carbohydrate that is not bad for you, or that won't keep you from losing weight, should I say. All right, the other forms that I've talked about, just want to be clear, they cause a problem. So on the next video, I'm going to talk about, I've talked about eliminating carbohydrates. On the next video, I want to talk about, okay, well, what should I eat generally? If you're telling me I don't eat all these things that I'm used to eating, well, then what should I eat? What's the ideal diet for me to be eating? And I'll talk about that on the next video. So until we talk again, I'll give you the tools, you give me the effort, and together we overcome obesity.